Welcome to Liz Talk. I'm Liz Dalton. So glad to be with you this morning with talk that's good for your mind, your body, and your life. Have you thought about your plans if you get sick or if you are housebound? Well, there's a new kit in town, and we want to tell you about it this morning. It's called Remain at Home Senior Care, and I have with me in the studio this morning Brian Kerrigan, founder and CEO, and Leslie Kimball, administrator and director of patient advocacy. Good morning.
Good morning.
Good morning. Happy to be here, Liz.
Well, we're excited to have you because this sounds like a novel concept. So explain to me the difference between your business and hospice and home health.
Okay. Well, they all three overlap in the sense that all three take place usually in somebody's home.
Mm-hmm.
Now, with hospice, it is more end-of-life care.
Mm-hmm.
With home health, it is curative care and hospice and home health are both done on an intermittent basis,
Mm-hmm.
meaning you have a nurse that'll come out a handful of times a week to care for the patient and provide assistance and so on and so forth. The spirit of our service is that our folks are skilled in the way of licensed personnel,
Mm-hmm.
but we are in lieu of or an option to not for seniors to be kept out of skilled nursing homes,
Mm-hmm.
assisted homes, personal care homes. Everything is kind of a la carte for lack of a better explanation. But if a client wants or needs to have somebody with them 24/7, 365,
Mm-hmm.
we provide that.
Wow. It sounds expensive. So how do you compare to the other services in that regard?
It's a great question, because whenever you say private duty,
Mm-hmm.
everyone says, well, it's this elitist service, right? Against the high-end range of, let's say, a nursing home and an assisted home,
Mm-hmm.
we are slightly more. However, the government evaluates folks in one of two ways. One is you're either you've completely expunged all of your assets and you're therefore not solvent, and they manage your long-term care.
Mm-hmm.
The second is that you haven't expunged all your assets, and therefore you have to pay for all your long-term
Mm-hmm.
care. I mean, I'm being simple, but that's
Right.
it's one of two
Mm-hmm.
areas. So if you fall into that second boat,
Mm-hmm.
and you are paying out of pocket for a nursing home, an assisted home, a
Mm-hmm.
personal care home, why not take the opportunity if one is given, and that's what RA, as it's affectionately called, does. We're able to keep folks at home and out of those kind of institutions for a dollar amount that is on the high end of the range that they would pay. Now, our benefits comparatively are just night and day.
That's good to know. Like what?
Sure. Okay. Well, in terms of a skilled home, you might have one person taking care of 40 folks, and some of them, some of them do a very good job. I'm not saying there's malice or anything like that, because some people do enjoy that type of setting, right? But from my experience, most don't, right?
Yes.
So for one-on-one coverage, and also I come from a hospice background,
Right.
which in hospice, it's not about just treating somebody from a clinical standpoint. It's also treating the whole person.
Yes.
It's a holistic form of care. You
Yes.
have several folks, above and beyond just nurses, like chaplains, CNAs, dietitians,
Yes.
doctors. And I thought to myself, because I'd been in hospice for so many years, excuse me, that, if we are providing all of these great services to help self-actualize folks prior to passing, why don't we do that for people that are still alive?
Yes, that's an excellent idea. Well, Leslie, as patient advocate, and patients do need advocates, what types of things do you do?
I make sure that our clients have the quality of life that they deserve. And it is everything from communicating with the doctors to the family, wherever they may live in the country, keeping the children informed. Actually, our website has a family portal. So if the son or daughter, brother, sister lives far away, they can log into this on our website, and it gives them daily updates of what's going on with their loved one.
Much like Caring Bridge, but specific to
them. They're given a special password, and they control who in the family gets that password.
Oh, that is great to know, because oftentimes the children and other family members are in different places. So as Brian said, it's not just for the end of life, it's for during your life when you're having a difficult time. Is it true that you actually will run errands or can drive the patient using their car or your car?
Yes, ma'am. We are licensed to do either. We have found that the clients really like to be driven in their cars more than anything. And, the person doesn't have to necessarily be ill. Just maybe have gotten to the point where they can no longer drive, but they're still active.
How interesting. I bet that's refreshing for them, especially if they're in their own car.
When we tell the seniors that, they get really excited.
Yeah, and Liz, our model is that of empowerment.
Yes.
It is at a time, with there are two types of care out there. One is curative. The other one is palliation. Curative is just that.
Right.
It's when you seek a cure. That's your home health or whenever you go into a hospital. And then there's palliation for folks that just need comfort care.
Yes.
Right?
Yes.
So with our service, we're taking this holistic hospice approach. I've essentially taken the hospice overlay, although people get scared of the H word, right?
Yes.
For folks that aren't terminal, and they are able to actually have a say as to what they get from a care standpoint. So if they are not interested in seeing our social worker to help with psychosocial issues, then guess what? They don't have to.
Wow.
And if they don't want to see a volunteer, they don't have to. So it's one of the only times in curative health care where the patient and or the patient's family really is empowered to make that call.
Yes. Leslie?
Yeah, I just wanted to add on to what Brian said. We do have cases that, some of our clients might be on hospice or home health, and it's very tiring for the family to try and be the caregiver. So you can think of us as being in the home so the families continue to be a family.
Yes.
And not worry about the caregiving aspect of it, the clinical aspect of it.
Well, very important. I think the way you described it as a la carte is definitely a way to differentiate yourself. And I commend you. I've been talking to Brian Kerrigan and Leslie Kimball. They're with Remain at Home Senior Care. Check them out. We'll have their website on our website at 1340WGAU.com. I'm Liz Dalton. Thanks for listening. This is Liz Talk on News Talk 1340 WGAU.